Good morning. My name is Hamdan. I'm from India. I live in Dubai. Not too long ago, it was the flu season and I had a prolonged cough, and we went and showed the doctor and he advised an x-ray. There was a cloudy area in the middle of my chest in which we proceeded with a CT scan, and I was diagnosed with a small growth in my chest area. We consulted doctors around the world in England, Australia, Dubai, India, and all recommended to come to Medanta and get treated by Dr. Belal and his team. We came here, we met Dr. Belal for the first time. He's a very nice man. We enjoyed our meeting. He advised us for a PET scan, which we got done. We had a biopsy done too, which was done in Dubai, but we got it reviewed in Medanta. And then he advised us for surgery. The surgery was a keyhole surgery, nothing to be opened. We got admitted a day before.
Mr. Hamdan is a young football player. He lives in Dubai. He was having, I believe, cough for 2-3 weeks, and then he got an x-ray done which showed a lesion or an abnormal shadow on the right side of his chest. He was further evaluated by a CT scan which revealed a mass lesion which was arising from the inner lining of the chest wall known as the pleura. So basically it was a pleural-based mass lesion. And then he consulted doctors in Dubai and they got a biopsy done. The biopsy was suggestive of benign lesions. Beyond that point, he had differing opinions by doctors in UAE. Some of them suggested him to observe the lesion for a while and remove it only if it grows. The others suggested removal of the lesion, and so he was very confused. And then he got in touch with me. I had a look at his CT scan. There was a pleural-based mass lesion which was very close to the heart. And I told them very clearly that even if it is a benign lesion, because it is located in such a precarious location, if it increases in size, it will be much more difficult to remove it later rather than now. So I advised him surgery. We did a thoracoscopic excision of the tumor, which is a kind of a minimal invasive surgery where you put small holes and then you take out the tumor without the need of cutting open the chest completely. And by God's grace, he recovered very nicely. Within 3 days' time, he was out of the hospital. And now I believe he's back to Dubai and is doing all his regular normal activities as he was doing earlier. So minimal invasive thoracic surgery has made an important difference in his approach, because had it been an open surgery, it would have taken much longer time for him to heal. But because of the fact that he underwent keyhole surgery, it has allowed him to heal faster, and within a week's time, he was back to his normal.
The surgery was performed 4 hours, was shifted to ICU straight after. ICU was great. 24 hours after, I was shifted to the ward. There was a specific gym there. There was doctors like Dr. Vineet, Dr. Deepika. They took good care. I was made to exercise every single day. Dr. Belal, I met him in the ward almost every day. I had a chest tube. Doctors came to the ward daily to check on the chest tube drainage and if everything is fine, if there's any pain or anything. The nursing staff was always available. Whenever you press a button on the bed, they would come straight away. They answered all my questions and helped me feel relieved. I stayed there for around 3 days. Then everything was removed and I was good to go and discharged. We had 2 follow-up visits with Dr. Belal and everything was fine. I would like to thank Dr. Belal and his team for taking good care of us at Medanta. I've been living in Dubai for the past 10 years. The hospitals there are not very crowded. It's very easy to just walk in, talk to people and relax, sit down. As soon as we entered Medanta, there was a huge crowd. There was a long line for the elevator. Har counter per bari lines thi. Food court mein bahut tha. But as we kept coming here for a few days, realized that sab kuch bahut jaldi move kar raha tha. Everything was moving fast. There was not a long waiting queue. Everything was clean. And we were happy with the treatment and we had a good experience and our problem was solved.